Welcome to the PSL Dentist Podcast, where healthy smiles meet real talk. Hosted by Port St. Lucie's very own Dr. Stephen Blank, the one dentist who's been making the Treasure Coast smile for decades. From one-visit crowns to clear aligners, Botox, and even lifting threads, yep, your dentist does that too. So sit back, open wide, not literally please, and get ready to sink your teeth into today's episode.
If your teeth, jaw, and muscles are not working together, your whole mouth can feel out of balance. Today we're uncovering how small adjustments can create big relief. Welcome back, everyone. Frederick here in the studio with Dr. Stephen Blank, your Port St. Lucie dentist. Dr. Blank, always good to have you. How are you feeling today?
Good to be with you in the studio, Frederick.
Nice. So Dr. Blank, this is a topic that many patients don't realize affects their comfort, their chewing, and even their headaches. So can you tell us, how does bite adjustment create harmony in the mouth? Please help us understand what's really happening when the bite is off.
So that's a great question. A lot of people don't even know they have a problem with their bite. They have symptoms. So the symptoms patients present with are headaches in the temple area, the forehead, sore jaw on the sides, the muscles right at the corner of the jaw are really tight, or they wake up achy in the morning. So they have a lot of symptoms that they present with. So part of the evaluation is to find out, how does your bite fit in with those symptoms? Does it have anything to do with it or not? So part of our dental examination is to check your teeth in an ideal healthy mouth. When you close your teeth together ever so gently, or if the dentist guides your jaw shut with the hinge in the center, all your teeth should meet at the same time. When that happens, your muscles, your brain tells your muscles, relax. So your teeth touch, your jaw falls open just a touch, your lips are touching, but your teeth are not. That's a relaxed position. So when patients have some disharmony in that situation, in that environment, then things get changed. The stimulus goes to the brain thinks about stuff, it does it in the background. So patients clench or grind their teeth or wake up in the morning with sore jaws because they've been working out all night long. And that creates a problem. So when we adjust patients' bites, that makes things more even. But then a lot of people ask, let's take it back a step. How did we get our bite to not be happy? What caused all this? So often when we start when we're just little babies, when our teeth first show up in the mouth, there's nothing in there. We just have two gums slapping together and mostly drinking milk. Then we start to grow some teeth, and as they come in, the top ones and bottom ones find each other, and they hit together, and the teeth stop in that position. And the stopping in that position is an important thing to remember, because when patients lose a tooth, a common one is the first molar on the bottom. They get a big cavity, they have it pulled, and they think no big deal. The top tooth starts erupting again. It's looking for a brother. It wants to find another tooth to chew with. So bite stability is when all the teeth are present, lined up in a nice curve or an arch, a dental arch, we call that, and everything touches at the same time. When a tooth, all sorts of things affect that. Some of the things that affect it are our tongue, the muscles. When we clench our teeth, the tongue is a big muscle in the middle that can push them forward. When we have airway issues in the back, our tongue postures more forward. It can push the top teeth so far apart that they don't touch in the front. We call that an open bite. All sorts of things can change your bite. Dental work can change your bite. If a dentist puts a filling in or a crown and your bite is no longer in harmony and you're numb, you don't even know it, and you go home and it feels a little funny, and then you kind of get used to it, but you're not really used to it. You now have a bite that's not in harmony. Or if a tooth gets chipped a little bit, just growth and development changes, all sorts of things can cause our bite to change. Some patients have trauma. They get hit in the chin, the joint back here changes a little bit, or the cartilage inside that joint changes. It gets flattened out in the TM joint. If the cartilage gets squished just a little bit and the whole jaw goes up just a little bit, all of a sudden the back teeth touch more than the front teeth. Now the harmony that we once had is no longer there. So that's how we get into some of these situations. Many different ways to get there. And then the treatment is to evaluate the patient. What touches first? After they touch that, does the tooth shake a little bit or does the jaw move a little bit? So some people will close, they'll bump on a tooth on the right, and their whole jaw will shift a little to the left. And then all their teeth touch. But that's not in harmony. It takes muscles to hold your jaw crooked. Very tiny little distance, not far, but that's enough to set down a cascade of negative events. That's when the headaches start. People tolerate it for a little bit, and once it crosses that threshold where they can't tolerate it well, then they start feeling things, sore teeth, headaches, throbbing somewhere, just things that aren't good. Or we see cracked teeth. That's the other real bad one. When patients come in, my tooth is hurting. It feels like the filling's loose, and there's nothing loose. The tooth is split in two. So those are the kind of issues we're trying to prevent before they get big by examining the bite and making adjustments.
So, when it comes to examining the bite, what tools or techniques do you use to evaluate the patient's bite?
That's excellent. I start with a clinical exam, and part of that is literally holding a patient's jaw in a method that holds the little balls, the condyles, which are the top of the lower jaw, holding them in the center of the socket, and then seeing when we close together what touches first. If I tell you to bite, you can stick your jaw out, you can go left and right. Patients go everywhere but straight when I ask them to. But when I do a manually guided closure, we find what their true centered position is. And then we can determine which tooth touches first. And I'll ask them, what tooth touches first? They'll go, all of them. And then when we check like that, they go, oh, the one over here. And then we repeat the procedure a few times until we have a consistent answer of which one touches first. So now we know which one touches first. The next exercise is I tell them we're going to close your teeth together just like we did. And now when we hit the first point that stops, I want you to stop. So we'll go tap, tap, tap. Now tap lighter and lighter. And once we hit that spot, you freeze. And then when I say bite, I want you to squeeze harder and we watch the jaw. And I either see the jaw shift just a little bit or I feel a tooth shake a little bit. And we do that once or twice until we have a repeatable result. Then, based on that, if we have a tooth getting traumatized, we adjust the bite on that tooth so that it's not getting shaken every time they close. Repeated shaking like that can either harm the tooth or beat up the bone around it. So now we get a loose tooth when there's nothing else wrong with it. So we want to, get them back in harmony where it can heal again. If the jaw shifts, that gets all the muscles that hold the jaw steady sore. Patients tolerate it again for quite a while. And then when they get past the point that they can't tolerate it, or they have a high stress day, a busy job, the kids get home, all sorts of other triggers, suddenly they can't deal with it and their jaws start hurting or they get a headache.
Wow, wow. Thanks for sharing all that info. What does the adjustment process actually feel like for the patient? Can you
Good question.
give us that point of view?
So when we do that adjustment, patients always question me. I don't think I need this. I hear that all the time. And it's kind of like having a little tiny pebble in your shoe and you walk around with it and you don't think it's any big deal or it's a little annoying. And when you finally take it out of your shoe and put your foot back in, it's like, that feels good. So when I adjust the teeth, we do it with the patient fully awake, not numb. We don't, no injections or anything. We're not grinding the teeth down like when we do crowns, very minimal drilling. It's just selective adjustment of certain spots. So we mark it with the bite paper. We double check on what they feel first, and then we adjust that spot. If it's on a natural tooth, we use a pretty smooth burr. If it's on a porcelain tooth, we might use some adjusting stones, and then we have to polish everything back to nice and smooth at the end. So you don't feel it. There's not a whole lot done. And then when they close, I hear this all the time. Oh, that feels better. So from the person that 5 minutes ago told me they did not need anything. So that's a common thing that we hear.
Wow, wow, that's amazing. So my next question to you, I think you just answered it. My next question to you was, how quickly do most people notice improvements after their bite is balanced? And is it like an instant thing after you've balanced it immediately? They're like, oh my gosh, this is how it's supposed to be.
Yes, no, and maybe. So for many, many people, they feel it right away. They can tell there's a change. and that's for the better. That if the interference has caused the tooth to be loose, we adjust the bite, but then the tooth has to settle down and get tighter. So literally, you grow more bone back around that tooth where it doesn't wiggle anymore. I can tell them to put a finger between two teeth and tap, 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 and they'll feel one tooth dancing. It'll bounce a little bit, but they don't feel it unless they're looking for it. So the patients that have tooth mobility take longer to heal, and sometimes I'll see them 3 to 4 weeks out because they'll leave saying, "Oh, feels great now, feels great." And a few weeks later, they say, I'm feeling another little spot somewhere because now the tooth isn't moving, and we adjust that. The ones without mobility that just have a jaw shift, I adjust it, and then they don't have a jaw shift anymore, and they're often done in one visit. But sometimes we still have to do a follow-up a few weeks later, and we have to make sure we have you in a range that you can accommodate to. So that's a great question. Some people think one and done for everything. It's like, no, it's not that simple. It's a human body.
Gotcha. Well, Dr. Blank, thank you so much for explaining how such precise adjustments can make such a big difference. We do appreciate your expertise, and everyone at home, thanks for tuning in, and we'll see you all again next time.
Thanks for the great questions today.
That's a wrap for the PSL Dentist Podcast, where smiles are brighter and laughs are always cavity-free. To keep your smile in shape, call 772-878-7348 or visit psldentist.com to schedule your appointment with Dr. Stephen Blank, the one-stop doc for smiles, beauty, and everything in between. Until next time, keep flossing, keep smiling, and keep listening.